Hey guys, welcome to Crazy Empty Nest. I'm Lance.
And I'm Jenny.
So we're continuing our journey in Malawi here. We are out now this week. I don't know how many villages we've done now, maybe 3 or 4 different villages, going out and just going to remote areas and bringing these healthcare resources here. So this is a brand new optometry tool that was developed by a friend of ours called Kevin White at Global Vision 2020. And this tool essentially is the same thing you can get at an eye doctor or an optometrist's office, but we can make it portable and compact to where we can take it out to these villages and get almost the same results with, I would say, 90% of people that we have out here. So this tool actually won the best humanitarian aid tool of 2020 by the United States Congress. And it's kind of at the ground level right now. It's becoming very revolutionary. But essentially what we can do is go to these remote villages where they don't have any access to healthcare. We were just talking with our friend who said it's 45 kilometers to the nearest hospital. It's about 2 or 3 hours to the nearest eye doctor that could actually do this for you. So we're able to bring this to the local villages and give them low-cost glasses that honestly nobody else in the country can beat these prices. So Jenny, do you want to talk a little bit about how this works? How does the tool work? Sure. And what we're able to do?
Sure, it's a very simple tool to use. When I was showing one of the optometrists how to use it, he was very impressed with the simplicity of it's color coded, so the prescription is color coded and has number codes as well. So you can do the chart first and get the baseline, kind of where they're seeing.
On the eye chart. On
the eye chart, yes. And then we put on the tester glasses, which has all these different prescriptions down a line, and they turn this little piece that helps it go up and down until they can see the chart more clearly.
Yeah.
Then we test again. And we do this several times sometimes to make sure we have it just right.
Yeah.
And so like red 1, for example, on one side would probably be the equivalent to like a -1 prescription.
Mm-hmm.
And then we have a table set up of all the different lenses, like red 1 lenses, red 2, which is all the different prescriptions in different colored envelopes. And then we pop it together in the frame color that they choose. They can choose red, brown, black, and they can have their glasses within like 5 minutes.
Yeah, it's amazing. And then we also have local optometrists here that have actually come out with us this time. It's really awesome because for that 10% of people that have maybe cataracts or they've got growth or just things that you know, glasses probably isn't the best prescription for, the optometrist is here to diagnose that and say, yes, they need surgery. He can actually write them a referral at that point and say, next time you can get to a clinic, you may want to look at the cataract surgery. But we're also having some great success with people with cataracts of, even though they're going to need a surgery eventually, getting them to have better vision. So here we are, we're on the border. That's Zambia over there. This is, we're on the Malawi side, but if you go walk down the end of the street, you're over in Zambia at that point. But we don't want to pay the visa because we're not going to Zambia today, so we'll stay here.
Is that your energy drink from Africa?
And the idea, the one thing we want to stress behind this thing is this is not about Lance and Jenny, people from the United States, Canada, Westerners coming here and providing this. This is a simple tool. We're actually just trainers to be able to train the local Africans who can then replicate this and do this for other Africans. So the idea is this creates a sustainable business model for them to provide a business and an income for themselves. And on top of that, we're providing glasses for about $3 US or Canadian which is significantly lower. If a person was to go to the capital city here, they might pay $50, $60, $100 US or Canadian for a pair of glasses. So we are providing it for, they can't believe, the optometrists are saying, I don't know how you're able to do these prices. They think that it's coming from contributions or something like that, but this is the way we've set up this business model, is to create, very, very low cost glasses, because the whole idea, it's not a business, it's to help the poor. But on the flip side of that, this also provides a small income for the local Malawis who are going to be running these clinics when we're gone, and it's able to create a sustainable business, or a humanitarian aid, or an NGO, or a faith-based organization can use this to create income and then continue and sustain the business and keep doing this all over the country. The exciting thing that happened while we were here, the organization we're working with here in Malawi got their license to do their own clinic. So now they're able to set up micro clinics in areas that really need it, and they can come in and provide this service in many different locations, so people don't have to drive 2 and 3 hours to go get glasses somewhere. And I think some of the remarkable things, Jenny, too, do you want to talk about the income from the glasses is one thing, but what they're using the income for is pretty awesome. You can talk a little bit about that.
Right, yes. So the faith-based organization we're working with, they are going to be able to use this income to, buy more farmland and have, they have brilliant agriculture here. So this will take this a step further for them to have more sustainable agriculture, and then whatever is overflow, they can bring to the markets and they can sell it there. And
they've also had local restaurants already saying, like, we'll buy lettuce from you, we'll buy produce for you. So this one little tool is creating enough income to one, create income for families, 2, buy more farmland, which then creates more food and vegetables, and then that creates an additional income by the overflow of agriculture to be able to do this. And this is we want to stress that this, for us, Malawi is just the start of this. This is kind of the proof of concept, or the test case for Africa. What we're really hoping to do is work with some of the African leaders here to replicate this throughout all of Africa to places that need this. And it's an amazing tool. It's a ground for our opportunity. Now, I know that was a lot. We wanted to explain that because some people were having questions about what is this and how does this work. But we also want to take a second and just give you some success stories. And Jenny, do you want to share the story we had the other day with a nurse? It was awesome.
Right. We had a nurse that works at one of the local hospitals come in, and she had her eyes tested, and she was able to have a significant improvement. And she was so excited, so she wanted to be trained to be able to use this tool as well, to be one of the locals to use this tool and be part of this. And then as we're training her, the light bulb started to come on, and she thought of her sister who has diabetes, had a stroke, has significant health problems that have affected her vision, but she hasn't had the means to get to an optometrist professionally to have help with that. So she, ran, got her sister, came back about an hour later, and we helped her through the process. And she went from seeing only like line 2 or 3 to having 20/20 vision.
With the glasses.
And the tears and the laughter and the praise was overwhelming. There's a beautiful, beautiful thing to witness.
So we're having these success stories everywhere we're going. We traveled about 3 hours this morning to get out to this remote village. And everywhere we go, the people are so excited. And it's just, I don't know, for us, this is one of those things, it's a ground floor opportunity to, again, have Africans helping Africans. They don't need Lance and Jenny here. They don't need Westerners here. Once they're trained, they can do this for themselves, and that's the beauty of this thing, is we just provide the tool to get them started in the training, and then they can sustain it by themselves, which is an awesome, exciting thing that we're doing here. So guys, we're going to keep going on. We've got another week that we're going to be doing some more clinics like this and some other stuff, and then we're going to be going out to one of the most beautiful lakes in all of Africa for a little bit of R&R and having some fun and taking you guys out on that adventure. It's been grueling. We've been doing 18-hour days, and I'm going to be honest, I've been tired every morning. I don't know how many pots of coffee I've been drinking.
You've been doing all the driving.
Driving in Africa is a lot more stressful than other places. But that last week, we're going to take some time and just relax and go to a beautiful eco resort on one of the most beautiful lakes here in Malawi. I want to take you along and show you that, because we definitely, if you're looking for a holiday or a vacation, we definitely recommend coming out, and we're going to show you that.
Yeah.
So with that, guys, as always, we want to tell you guys, do good
And stay crazy.